Hey everybody, it's Jason Russell, student physical therapist assistant at Jefferson State Community College, and today I'm going to be talking about Lyme disease. So, Lyme disease is exposure to the bacteria Borrelia burgdorferi, and I'll call it B. burgdorferi for short later, just because it is a mouthful. It is passed on from tick bite to humans, where it will enter the bloodstream, and from there it can become multisystemic, affecting just about everything in the body, but it primarily or has more symptoms within the neurological system. The symptoms can be acute and be seen immediately, as we'll discuss later, or remain dormant or latent within the body for months to years before it will present itself. So, common diagnostics that are done when a person suspects that they have been exposed to B. burgdorferi, they can go to their physician, and the most common diagnostic a physician will measure is a erythema migrans rash, and they want to see if it is at least 5 centimeters in diameter, and also lab tests where they will try to take a sample and determine if B. burgdorferi is present within the sample. Now, this can be difficult to culture this type of bacteria, which will commonly lead to false positives and false negatives. Newer tests are being developed by physicians and researchers that have not been globally recognized and globally certified. So at the moment, Lyme disease does not have a 100% sure or guaranteed diagnostic test. So as far as lifespan changes, once a person has been exposed to B. burgdorferi from a tick bite, if it is not treated within the first 48 hours, that is when the bacteria will start becoming dangerous and doing damage to the different systems of the body. So if left untreated for more than 48 hours, it can affect the cardiac system with the heart, as mentioned, the nervous system, your skin, and a lot more that don't really deal with physical therapy as much. For example, conjunctivitis of the eye. But within the central nervous system, you can have meningitis, cranial neuritis, motor and sensory radiculitis. It can affect cranial nerve conduction, swelling of the brain. So the pressure of the swelling will put excessive force on the different lobes, and then the corresponding function of that lobe may be impaired, damaged, or even permanently gone, such as your mood, concentration, memory, and even sleep. Age groups affected, or the demographic affected, because it is a vector-borne disease, which means passed from an insect to its host, or from the insect to a human. It is not specific to any age, race, gender, nationality. It really depends on who's in the woods and who was bitten. So whether it be a 20-year-old white female walking her dog, or a 70-year-old African-American male preparing for a marathon. It just depends who is exposed and how quickly they seek medical attention. As far as the prognosis, as I mentioned, once the bite has passed the bacterial disease into the bloodstream, if it's not treated within 48 hours, the prognosis is very bad. If it is recognized and seen by the physician and treatment can begin, the prognosis is usually full recovery to very small amounts of damage. The most common medical treatment is the use of antibiotics such as doxycycline, amoxicillin, and cefuroxamine acetyl. They're the most cost efficient and the most effective, and they give the patient the best prognosis. They can be given either orally, through pills, or through IV. If through pills, they will give them several small doses over a longer period of time compared to an IV, which may need to be done in the case of closer to that 48-hour range. So, how can PT help? As I mentioned, Lyme disease is multisystemic, so it does affect systems or portions of the body that are outside of the physical therapy realm and outside of a physical therapist assistant's scope of practice. But as far as what we can work on, with impairments such as pain, decreased range of motion, and more, physical therapy can help patients learn to manage their symptoms, such as inflammation is one, to help reduce the functional limitations that could eventually lead to disabilities and hardships in their life. A big thing is education, one on exposure to B. burgdorferi, kind of knowing how it was transmitted, how it can happen again. Prevention is a big part, but also education of the modalities that you can use in clinic and at home, whether it be heat or ice, and the modalities in clinic that aren't available to them. So as far as precautions and contraindications, there's no contraindications that I found in my research, but as far as precautions, what I kind of came up with was, because Lyme disease affects the central nervous system and it can affect the brain, mood, concentration, sleep, and things like that, you want to check the patient before treatment starts to make sure that they are mentally stable, that they're not aggravated, and that they know what's going on. Just check the mental status. Also, before any modalities, again, because it is central nervous system, you want to check sensation of the skin before you apply any modalities. So, factors affecting treatment, there's a few. Since Lyme disease has one of the symptoms being difficulty concentrating, you need to plan your exercises to be very concise, kind of straight to the point, and very easy to follow. So giving them a long list of things to do, pat their head, rub their belly, close one eye, stand on one leg, is going to be very difficult. And the modalities need to be planned first, with decreased range of motion, with joint pain, with inflammation. Some of these things need to be addressed before treatment starts to give the patient the most beneficial treatment and the best chance at a better recovery. In closing, Lyme disease can present differently in everyone depending on the lifestyle before the exposure to the bacteria, when the signs were recognized, when treatment was given, and the extent of the treatment given. Again, there are several that are not listed, that are not technically clinically approved yet, so they may have different effects on how well they attack the bacteria, if they remove it, if they damage other parts of the body in an attempt to remove it. So you need to talk to the patient to kind of understand what they have figured out about the disease. If they know that they become easily agitated, if they become easily confused, if they forget instructions, then you can better manage your time and theirs, and just have a better treatment in general. At the end of the day, you're here to treat the patient, and in the physical therapy world. So understanding them and what they're going through is going to help you get through to them so that they can have the best outcome possible. And that concludes my Microteach. Thank you guys so much. Please post a discussion and I'll get back to you.